In this range of motion testing, we're going to be covering the cervical lateral flexion. Now, of all the cervical testing, this is probably the most accurate to do. It's also the one that involves all the muscles. So yes, we can do rotation, flexion, extension, but our lateral flexion actually incorporates all the same muscles that you would also test in all those other cervical range of motion testing. So we're going to cover this one as our major tell-all sign of what's going on in the C-spine. Now there are, as you can see here, there are a ton of muscles that will restrict our cervical lateral flexion. We have the scalenes, the levators, the upper traps, those sternocleidomastoid muscles, the splenius, the semispinalis, suboccipitals, and the transversal spinals as well. Now we also have portions of the erector spinae that come up, and the plasma, those cool muscles coming up the neck into the chin. So as you can see here, we've got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 different muscles all affecting how this works. In terms of joints, we had the facet joints in the spine, the intratraverse ligaments and the facet capsular ligaments as well. Those ligaments attaching, those little nodules that come out of the spine, those play a huge factor in terms of how the neck works as well. Now in terms of setup, if you notice we have a small piece of tape here on the lower portion of the C-spine, and to find that, you're going to run your hand down and you're going to feel that bony process right here. That's where you're going to start our tape and just go straight up through that C-spine. Our optimal range of motion is going to be between 30 and 45 degrees. So we're going to set up our little goniometer here. Now, nice tall position. We're going to laterally flex to the left. Good. We're going to take our measurement here. So we have, switch sides, sorry. So just stay nice and tall. Okay, go ahead to the left. And we have, less than 15 degrees. Now go ahead to the right. We have a little bit better here. And no, also under 15 degrees. So we have a lot of tightness and a lot of stuff that could be going on. So a lot of times the upper traps, she doesn't like that very much at all. We also have the actual facet, the joints through the neck. One thing I do recommend, when it comes to a lot of this, the actual joint structure being very tight, if you notice that you go through some of these, so you're doing some of the stretches for sternocleidomastoid, for the levators, the scalenes, you're going through the upper traps and releasing a lot of this, and we don't have a lot of improvement, I'd recommend doing some outsourcing. Some good manual work, some adjustment work, some of the deep tissue surrounding the spine, clearing up some of that joint restriction is going to be ideal. So again, when you see a lot of people with that forward head positioning, they're in this positioning all day long, you're gonna get a lot of tightness in through this area. Some of that tightness will cause some joint restriction. So sometimes when we do release a lot of that tightness, that joint restriction is still there, you might wanna outsource for that.